The Trump administration announced major changes today in its COVID-19 vaccine distribution approach. Health and Human Services Secretary Alex Azar says the government will no longer hold back required second doses of vaccines, practically doubling supply. And he says states should immediately start vaccinating other groups, including people age 65 and older, as well as younger people with certain health problems. Dr. Bob Lahita, professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital, joins me now on Skype to talk more about this and some of the other developments in the nation's fight against COVID-19. Dr. Lahita, welcome back. Great to see you. As of yesterday morning, the government had good to have you on. As of yesterday, the government had distributed about 25.5 million doses, but only about 9 million people had received their first shot. How significant do you think these new changes will be in getting more people vaccinated?
I think this is going to be a wonderful advance going forward, because what we really need to do is get the vaccine into people's arms. I've heard of all kinds of suggestions, from having the National Guard learn to give injections, to having EMTs, volunteer EMTs in various communities give injections. We really need people that know what they're doing to give these shots so that we can go 24/7. It's not just a day job where you give 24/7, 7 days a week, where we can immunize just about everybody. And I'm sure if we do that, within a couple of weeks, we'll have millions of people vaccinated.
And Dr. Lahita, since you and I last spoke, a new strain of the virus has been identified and is causing some great concern. What more do we know about it, and how effective are the current vaccines in fighting it?
Well, let me go with the strains. First of all, viruses mutate. We've known that for decades. This virus is no exception to that. And as a virus really infects a community, mutations occur, just like influenza, just like measles. And so the B117 strain arrived in the UK. Then there's one in South Africa, which is the N501Y. Both of these are extremely infective, meaning, at least at the present time, what we know from science is that these viruses stick very assiduously to the ACE2 receptor, which is the receptor in your nose, your eyes, and your mouth. And throughout your body, there are ACE2 receptors. So once this virus gains a foothold, that's what happens. Now, these mutations there were 23 of them, actually. 17 were of significance. 8 of them were particularly significant. And one of them, which I mentioned, the N501Y, was very, very significant in that it seemed to alter the stickiness of the spike protein of the virus to the receptor, which means that it seems to infect young people with greater efficiency than the old folks that we are currently immunizing. And that means that this could be very infective. And the Brits saw this with the B117. They saw that people were getting infected at a rate of 50 to 70% more commonly. And right now, I understand the UK is almost in total lockdown because of the infectivity rate of this new strain of virus. However, the vaccine works. I'm told by the Pfizer and Moderna people that right now, at this time, the vaccine works against these new strains. Tracy?
And that is very good news. Johns Hopkins University data shows that COVID-19 hospitalizations right now in the U.S. have surpassed 100,000 for the last 40 straight days. What are you seeing there in New York, and what's your biggest concern when it comes to COVID-19?
Well, my biggest concern are the people who are unpredictably ill. So it's like Russian roulette in a way. People are saying, well, I'm very healthy. I'm an athlete. I run track, I run or I jog 3 miles a day, and then they get the COVID-19 and all of a sudden they're flat on their back and gasping for air. And we have to intubate them, and sometimes they don't live beyond 3 days. That's the exception, certainly, but the virus is very infective, and I am concerned that people are letting their guard down. They're not wearing masks, they're not washing their hands, and they're not socially distancing. Now, I understand people have fatigue for this sort of thing, but you've really got to remember that we've just rolled out the vaccine now, and it's going to take a while for herd immunity to happen. So even if you've been vaccinated, as I have, as you see here, I still wear a mask. I still wash my hands. In fact, I made rounds today wearing rubber gloves and my scrub suit just because I'm fully aware of the fact that I can still transmit the virus even though I've had a vaccine, and others can give it to me as well.
Well, Dr. Lahita, we got to leave it right there, but always appreciate you coming on and always appreciate your analysis. Thank you so much.
Thanks, Tracy.